So, Ms. Freeman, how would you define healthcare management?
There's not one plain definition for me being in the field of healthcare management. I actually started off as a social worker.
Okay.
So there are different aspects to healthcare management, from when you walk through the door or when you call and make an appointment. For us, that's when the care starts, all the way until we complete a treatment plan for you. So when you come through the door, the contact that you have with our front desk, our social services department, which consists of case management, medical case management, standard case management, to when you see a provider.
Okay.
And they're providing care. Our medical assistants, they have a part in healthcare management. They triage our patients. The providers provide the actual care. Then referrals are made. So then it goes back to case management. They're providing care, making sure that if this person needs to see a specialist, they can do so. Coming back to the front desk, rescheduling an appointment. So if I had to describe it, I would say that it was a million parts working together.
Right.
Just to get one thing accomplished.
Okay.
So it's quite a lot.
Right, I see.
It's a lot that happens on a daily basis.
Yeah.
Mm-hmm.
Okay.
What's the hardest thing you've ever had to encounter during in your profession?
Here in the community health center facet is trying to find specialty care for an uninsured patient. It's very hard. Our focus here is primary care. We are fortunate enough to have some specialists on staff, but there are some things that are just beyond our scope. And trying to find that care for someone who is uninsured is very difficult to do.
Right. Okay. What inspired you to choose this profession?
I've always had a feel for social work. That's kind of how I got into this. I've always, my degrees weren't in social work. I have a bachelor's in criminal justice, and my first master's is in urban and regional planning. So I was always concerned about how people were treated. So I decided, well, I'll go to school and get a master's in social work to back up a lot of the job experience that I had. So it just kind of happened. You know, when you like doing something every day, it just happens. Yeah. So what is for you is for you. So.
You gotta like what you're doing.
And I like helping people. I like being able to make a difference. And there are a lot of things that we're not able to do, you know, for patients sometimes. But if we're able to do one thing, that's a small feat for us. So.
So what is a typical day for you, like when you come here to when you leave?
Well, it probably starts at about midnight when I get the alerts about who's out for the day. Or then it starts, and you know, those alerts go off. Then around 6 o'clock, I'll get, I'm sick or I'm out. So now I'm trying to figure out who's going to cover who, where. I'm calling around saying, can we get somebody to come from this location? Because we have 5 locations. So can I get somebody to come over here? How are we going to cover this? If a patient is upset, or it just depends. You never know what you're going to walk into when you come to the front door. But we have a great team of people, so that makes it much easier. Everybody here is willing to help. This morning we had, we've been chosen by the AETC out of Vanderbilt University to be a practice transformation site. So they're helping us kind of transform our practice into being a practice that we can provide clinically appropriate care for patients or persons living with HIV and AIDS. So we had that meeting this morning. They took a tour of our Brevard location, came over. We had a meeting about what we can do, what are going to be the first steps in this transformation. Immediately after that, they hosted a training here that was a live broadcast. So our staff did that on primary care for transgender people. We went out of that with that training. Then we had to make sure everybody got back to all their locations so we can keep the clinic going, because we don't like to shut down the clinic. And we had services starting back up at 2, so making sure everybody got back, cleaning up in there because it's not our room. Then I went to a 3 o'clock meeting, and now I'm here. And then I have, you saw that the people stopping me as I walked through the door. I'm waiting, 2 people waiting. The medical director was on the phone over there. It's a student that wants to volunteer. So it's a lot. And this was an easy day. This was nothing major. So, but it never stops. So, but we have good people here. We have a good team.
All right. The next question coming from the camera person.
Okay.
My question to you is, based off what you said and based off what little research I've done, I've noticed that we've all done. Noticed that a lot of community, like health clinics, a lot of it's based on educating the community. Because there's not a lot of specialists, you have to try your best to try to do preventative medicine and educate people. So with that being said, what is the level of difficulty associated with trying to educate people on better healthcare practices? And I'll just ask my follow-up at the end to that.
Okay.
Yes.
It's the difficult part is getting people in the door.
Okay.
Once they're here, we're able to educate. Our MAs are able to educate. Our nurses are able to educate. Our providers are educating. That's a part of what they do when they're here.
Mhm.
So, and we have a comprehensive community outreach team that goes out in the community and spreads the word about what we're doing and letting the community know that you do have access to care. That's why we're here.
Mhm.
So, getting patients in the clinic is more difficult. Once we get here, sky's the limit.
Okay.
Mm-hmm.
And as far as the follow-up, based on the education that y'all have done in different programs, different things within the community, have you seen an improvement in overall health based on programs? Or, is it about the same? Or have you seen like a gradual improvement as far as the number of people coming in for the same things? Or?
Definitely.
Okay.
An example is now that adults are able to be covered for dental services under Medicaid.
Okay.
So before, adults could not, if you qualified for Medicaid, you did not have an option for dental. That was something you had to pay out of pocket. We've had a dental program since 2014, and right now we have 9,100 patients who utilize that service.
Okay.
So just word of mouth. We don't have to say anything. It's a dentist over there that'll see you. And they're coming because, we have so many patients who've never had dental care. Now that's here. The service is here. They know it's here. And I'll show you, we put 2 operatories in this clinic. So now we have dental here in Leon County. You can come and get those services right here as opposed to just being in our clinic in Havana.
Okay.
And we're opening up an additional clinic at Rickards High School, and we're going to put dental chairs over there as well.
Okay.
That's just an example.
Okay.
All right. And another one, what would you say the difference is between a community health center and a managed care organization? What's like the main difference?
Well, they kind of work together in some instances because we have managed care organizations that we contract with. They provide us, they impanel us with patients. So we're saying, hey, we're here, we're willing to see anybody who comes through the door, and those organizations will provide patients to us. They impanel those patients to us based on the number of providers that we have. So we're working together to take care of the community.
Okay, so it wouldn't be like you have your separate things, you just work as a team.
It's 2 totally different organizations.
Right.
For us, managed care is a insurance company.
Okay, that makes sense.
It's an insurance company, and we're providing the care. So we have to work together.
What is a good number of practitioners to have in a community health center to best fit the needs of the community?
As many as you can find a space for. As many as you can find a space for. There are so many people who we still haven't touched. But if you have the space and you have the providers, sky's the limit.
All right.
Sky's the limit.
We're going ahead.